Thank you very much, the Right Reverend Dr. Fred Sheldon. It is also my first time to be invited by a bishop. Isn't it nice? The Diocesan Secretary, Ankole Diocese, the Dean, St. James Cathedral, the Chairman Board of Governors, Ruharo Mission Hospital, and all the board members, the Board of Directors, Dr. Keith Waddell Foundation, Dr. Keith Waddell, who is not here with us, we recognize you and your family, the medical superintendent and management of Ruharo Mission Hospital, our dear clients to the hospital, invited guests, the staff of Ruharo Mission Hospital, and all of you here present. Good afternoon to you all. Allow me first of all to start by thanking the Right Reverend Bishop Sheldon and Dr. Bitecherizo for inviting me here today. Thank you very much. This whole week I have been in the field visiting various hospitals. And Dr. Bitecherizo, in his message to me, made a mistake and said, we are inviting you to come on the 14th of May. And I responded and said, for the first time in my life, by that time I will be on leave. So I was very happy that I will be relaxed and I will come. And then on Tuesday, my assistant tells me, by the way, you are supposed to be in Mbarara City on the 14th of April. I told him, no, you are making a mistake. It is 14th of May. And he said, I'm not very sure what you're talking about. So I showed him the messages on my phone. And Dr. Medad had consistently repeated 14th of May. So my PA said, anyway, it is 14th of April, not May. So I said, but I will be very tired after having moved all over the field. So last night when I returned at 11 o'clock and I went to pray, I was trying to convince myself not to come. And repeatedly, I would see the face of the Right Reverend Bishop. So I told myself that when I wake up in the morning, I will decide whether to come or not to come. But by 5 a.m., that is usually my waking time, the only name that came to my head was the Right Reverend Bishop Sheldon. Bishop, I had no alternative but to travel, because I know it was a message from God saying, please go. And I want to thank God for repeating that message to me, because I would have missed to see such amazing things and amazing work God wanted me to see. And I am extremely grateful. Allow me to congratulate all of you for a job well done in this mission hospital, for your passion for excellence in this hospital, but above all, for the very many eyesights and lives that you have saved. We thank God for you. Thank you too for the very warm welcome. It is not very easy to get such warm welcomes. Very warm, and I do appreciate. My first impression when I stepped into the hospital, of course, the medical superintendent took me to a very large, spacious reception area. And I was waiting to see patients, to hear children crying, to see a very congested place. But I saw a very clean environment, very well organized. And of course, I've seen patients who are happy because they are contented with the services. And I want to say a big thank you. What you're doing here complements the work of government. And it does not only complement, it takes a huge burden off the costs that government would have to bear in saving all these lives. I first saw a case of retinoblastoma as a medical student, and it was very painful to me. But the pictures that I saw today and the hope that you give when you work on these children, although the pictures were very depressing, the hope that comes with it brings joy. So allow me now, in a special way, to appreciate Dr. Keith Waddell. I have never met him. Maybe if I did, through passing through medical school, I cannot remember. But the stories that I have heard here today makes him a very special person. And I went ahead to ask that where is he? And Bishop told me he has gone back to the United Kingdom. And I asked why. And then Bishop said he now needs to rest. He's elderly. What I can say is he has lived a very good life. He has given back everything he had, because that is what God wants of us. Give everything back. I think he has emptied himself to save humanity, to save lives. And he definitely needs to rest. He needs to sit down and just think and reflect on the many lives that he has saved. Allow me also to thank the parents who gave us testimonies here, very emotional testimonies that bring tears to the eyes. The children and the parents. But also there are testimonies of hope. And we have seen living testimonies. For example, the young girl sitting over there, 2 of them, those are testimonies of hope. And that is what encourages us to keep on moving. So my dear Bishop and your entire team, allow me on behalf of government to say a big thank you to you for this job that you are doing. I have seen and I have felt that the hospital needs a lot of support. And you have said it. Support in terms of running costs, support in terms of specialists, and of course support in terms of being available when we are needed. Bishop, allow me to say, whenever we can, I don't want to make promises now, whenever we can, and if I am still in this position, I will try my best to do it. We don't have very many ophthalmologists in this country. The numbers that we have are actually congested within Kampala city, and some are in private practice. Many of the countrysides, the regional referrals do not have ophthalmologists. If they do, it is either one or none. So you may be wondering, where do children with these problems go? The best answer will be to say they probably die. Maybe they never get to see any ophthalmologist at all. In any case, many of these patients are extremely poor. So there is need to train more and more ophthalmologists. There is also need to ensure that we have many other specialized personnel. You talked about specialized nurses for the cancer ward, but also specialized personnel in many other areas to support. Government is putting in effort, but training specialists is not cheap. And we have learned that along the way. It is not cheap. And it becomes even more expensive when they are trained and they are not recruited and they leave the country. Because you might want to count that as resources that has not benefited the people of Uganda, but have benefited humanity elsewhere. Congratulations on the cancer ward. Very beautiful ward, but like many of you have said, it is a small ward with very many patients who need help. And hearing from the medical superintendent, they come from all over the region, all over the region. I heard of Somalia, South Sudan, Rwanda, Tanzania, and many other places, including northern Uganda, where I come from. They are also there. There is need to expand that ward. I want to believe that working together, we can do it. And I have said working together, we can do it. There is a nice person who knows how to lobby. I was telling Bishop there that when I was the Director General of Health Services, Dr. Medad Bitecherezo was the chair of the Health Committee in Parliament. He was my chair, and I was the Director General. Of course, I would accompany my ministers. But he was a unique chair because he knew that the technical people had more information. So he would take me aside and ask me, this one, this one, this one, then I would tell him. Then he would chair. But when it came to plenary, with your permission, when it came to plenary, there would be a lot of drama and gymnastics. And I would get all that I wanted. All that I wanted, I would get. One time, he paralyzed the passing of the entire country's budget. He said if money for health is not increased, and he cried, he did all kinds of things. The budget never passed. So my budget had to be added. I really need Bitecherezo back in Parliament. You people, I need this man back in Parliament. Next year, I will be operating at 20% of my budget. 20%. Perhaps if this man was there, I would be at 50%. I know we are having challenges, but we need people who can push so that we set our priorities right. Now, this is a Lango from Lira coming here to ask you. But I'm not asking you for the people of Lango alone. I'm asking you for the people of Uganda. I need that man. Right now, he has done for me a very good job. But if he was there, I would be having some development money to put here on the cancer ward. That is what I am trying to express. But again, let me say a big thank you to you for all the children who have passed through that ward, whose eyesights have been saved, whose lives have been saved. And even those whom the foundation is now beginning to sponsor to complete their education. I learned something else today, the white cane. I have always seen the white cane, but today I was educated about the white cane. Right, Reverend Bishop, there are other partners that donate the white cane and wheelchairs through the Ministry of Health. I'm not aware whether you have ever received any of that donation, but I have taken note and I know them. And I now know where there is need. I have taken note. As I conclude, allow me once again to appreciate you. For a long time, I have been hearing of Ruharo Mission Hospital. And I have passed here many times, but I have never